Hello doctor. Today I will go through three pictures of a clinical patient seen by me yesterday. At first the X-ray says of a around 60 years villagers male patient who is a smoker around 40 years. The patient age is 60 and the history of smoking around 40 years, and he has history of coughing over the last 2 to 3 months, weight loss and low grade fever, night sweats. A typical history of something else, and try to identify the lesion on this X-ray for the next 10 seconds. Start. Hope you have identified the lesion. This is the lesion. This is a cavitary lesion over the left mid zone. It is a cavitary lesion and it is thick wall. Mind it is thick wall. So it is as a whole on the chest X-ray of this patient reveals that there is a cavitary lesions on the left mid zone. So it is just a cavitary lesion. It is just a cavitary lesion. It may be lung abscess or not. Okay. So on the background history of around 60 years, a smoker, villagers with a severe complaint of cough but no hemoptysis. It is productive cough, of course, weight loss, night sweats and low grade fever. So this goes in favor of as a provisional diagnosis, that is pulmonary tuberculosis, and it is the cavitary lesions in case of pulmonary tuberculosis means it is active pulmonary tuberculosis, mind it. So cavitary lesions for a pulmonary tuberculosis means it is an active pulmonary tuberculosis, obviously. Okay, so what investigation will you do next? Of course we will go for the sputum study for gram staining, acid fast staining, AFB bacilli, acid fast bacilli and culture and sensitivity. So in our low resource facility, usually we don't go for the culture, but usually we go for acid fast bacilli microscopy. So this is the test done in our settings, and look here. Okay, yeah, this is the sputum for the advice is the sputum for MTB or acid fast bacilli and gene expert. So on the this is the gene expert report done in our country in Bangladesh. Expert MTB rifampicin ultra TrueNet. So the test done is expert gene expert MTB. So it is the T. T means Mycobacterium tuberculosis detected, RIF, that is rifampicin resistance not detected. So it is sensitive to rifampicins. So it is T high, T medium and T low. It is as per the burden of the organism. Okay. On the next section 4, result of Mycobacterium tuberculosis drug susceptibility testing. Usually DSI, drug susceptibility testing index, is not done in this setting, but it is done in the central lab located in the Dhaka. So this is the diagnosis of pulmonary tuberculosis, evidence by clinical setting, clinical evidence, X-ray, and microbiological. It is the gold standard test is microbiological evidence. Now, how will you treat this patient? A general treatment management and a specific management. As per the general management, we will advise the patient as that he or she should use the mask appropriately for the next at least 6 weeks and should be isolated, of course, and the other family members should be tested for chest X-ray and sputum microbiology. As because the invariably the relative or family member might be involved or might be affected by pulmonary tuberculosis, and because it is very much uh, infectious. Now this is the treatment. Treatment is anti-tubercular medication. It is the 4 FDC and 2 FDC. The patient's weight around 40 kg. So the 3 drugs of 4 FDC for 2 months and 2 FDC drug 3 pill 3 tablet of 2 FDC for next 4 months. So it is total 2 and 4, total 6 months. For the first initial, that is called intensive phase, it is 3 tablet per day, and it is the 4 month, that is called continuation phase. Here the 3 tablet of 2 FDC for 4 months, and it is the 6 weeks, it is the combined name, it is the pyridoxine vitamin B6 to prevent isoniazid induced peripheral neuropathy. So on the left side, it is my prescription. It is the pulmonary tuberculosis, sputum positive. Treatment is started from 4/7/2025. The treatment date should be given because it is the starting date, and from this date, the month or the successive date will be counted and will be follow up. So pulmonary tuberculosis is a very important disease in our community. It is very important for the academic purpose as well as the clinician's clinical purpose. Thank you very much.